All right, okay, welcome everyone. This is Mariya Sokolova. I'm Executive Director of hello, and this is Dr. Mariya. There are two Mariyas, guys, today online. So let me make introductions. Yes. So I am here in USA. We, ADONIS Fertility International, we are North American headquarters of ADONIS Medical Group of companies. We located in Colorado. Dr. Mariya today with me from ADONIS Medical Group. And Dr. Mariya is in, where you located, Dr. Mariya?
I'm in Kiev, Ukraine.
Yep, you're in Kiev, Ukraine. Phenomenal. Guys, I'm going to be meeting you for one moment. Give me 1 second. And also, please proactively mute your lines if you can. Just a little bit housekeeping. At the bottom of the screen, you do have the chat function. Start adding your questions. We will make sure to ask them. I'm getting some noise. Okay, I'm checking quickly to make sure we have audio. All right. So we have a big topic today. Quite a few questions came in, but again, please jump in as well. We are talking today about the emotional side of assisted reproductive technology, right? That really spans to, IVF, including and surrogacy as well. Before we jump in, I just want to have Dr. Mariya maybe share a couple words about herself. Доктор Мария, немножко о себе, да, как вообще вы стали работать в области, какой ваш титул и, буквально пару слов.
Okay, I'm OBGYN, and I'm OBGYN in the second in my family because my mom is OBGYN too. It's my favorite field of medicine. That's why I chosen it maybe 25 or 30 years before. So I'm a practical doctor and I'm a chief of gynecological department here in Kiev. And my favorite theme is prenatal care and fertility services. So that's why I'm today, and I'm for our attention and for our question.
Wow, phenomenal. Thank you so much. And thank you for speaking English with us as well. So, oh, it's phenomenal. Please. No. So it's beautiful. You talking phenomenal. So I'm actually I'm admiring you because
what is your address, please?
Guys, I'm sorry, I have to mute some of you. Please, as you're joining, to mute. 1 second. Mute. Dr. Mariya, do we still have you?
Yeah.
All right. Okay. So let's put everyone to the common ground. So I know technically everyone knows what pregnancy observation means, what the role of OBGYN is. Just, when it comes to your world, in regards to assisted reproductive technology, and as you're working with ADONIS, what are the things, what's included in the pregnancy observation in both IVF and surrogacy?
I promised to Mariya answered in Russian for quickness of our conversation, so I'll turn to Russian.
Whatever is better for you, so please, whatever is easier.
Sometime I will speak Russian, sometime I'll speak English. So we should observe two sides, psychological or emotional, and physical or medical. And I couldn't choose which part should be more important, because the same importance about your mood, your emotional side, and the result of your labs or your examination. So that's why when you think about the waiting of baby, or maybe delivering, or maybe surrogacy, or etc., you should be calm, quiet, and sure about the quality of your psychological support. So if you meet your OBGYN or your prenatal care specialist first time, I strongly recommend to ask her or him about some points, not only the physical examination, but about your lifestyle, about your behavioral habits, about your mealing, about your work-life balance, about the quantity of your sleep. You should be you should sleep enough during pregnancy. You should be calm when you waiting your baby if it's surrogate carries out, and you should be very calm and quiet and peaceful into your soul, into your brain, into your mind during all period when you're waiting for your baby. And doesn't matter who carries him or her. Ask your health provider about the piece of advices for correct healthy lifestyle, because we are very different, and we have different knowledges, different habits, different jobs, and different age, different background, both psychologically and physically. So please ask, and don't afraid to be fool in the eyes of your provide healthcare.
Okay, let me break it a little bit, because you are bringing, that very important side as far as what conversations to have. So let's imagine it's a surrogacy program, okay? Because I know many of the families here, as I'm seeing some names, they are coming from the surrogacy journey. They might be considering surrogacy, or they might be already in the program. So here they are parents. Yes, so let's break into two parts. So when surrogate comes to you, so from the moment you're selecting the surrogate, preparing for the journey, like you're saying, it's very important to open. What questions are you asking her to help with these conversations? Okay, and then let's concentrate at the beginning, and then maybe also what questions we should suggest intended parents are asking themselves. Yes, that they also could start preparing for the journey. So let's start with surrogate.
Okay, maybe I should turn to the Russian because it will be more quickly for you.
Whatever.
If I say, когда я вижу потенциальную суррогатную маму, я обследую ее тело, и я обязательно интересуюсь ее ценностями.
Okay, so first, if we are speaking about surrogate mothers, of course, doctor at the phase of evaluation of surrogate mother, she will be responsible for, the medical evaluation. She will do all of the tests, everything that the OBGYN needs to do. But then one of the big questions that she's asking surrogates, at least the ones that she's dealing with, she's asking about their values. Interesting, why values? Tell us more.
I will explain. Мы настраиваем наших потенциальных суррогатных мам и отбираем их с этих позиций, чтобы они были не только здоровы физически, но и понимали, что у них огромная миссия. Их стараниями в их теле появляется шанс дать паре ребенка, самое большое счастье в жизни, в том случае, когда иначе рождение ребенка для этой семьи невозможно. И если наша потенциальная суррогатная мама это понимает, она хороший кандидат при отличном здоровье.
So when doctor speaks about values, what she is really looking for is, is this connection to a big idea that the surrogate is not just to carry a child, just as any woman would, during the pregnancy. She is to fulfill a very important, very vital mission. And so, that mission of carrying a child for someone and bringing this biggest joy. And that mission comes with a lot of responsibility, a lot of the, there is so much involved into it. So what are some questions you're asking her? I just want to imagine, because, it sounds so amazing, but I really want to know, what questions? So what would you say to her?
Я спрашиваю ее, понимает ли она, что ее готовность вынашивать ребенка для другой семьи означает, что ребенок будет отделен от нее и отдан родителям, для которых она его вынашивает. Она не будет кормить его грудью, и она не будет иметь отношения к его дальнейшему воспитанию. Ее миссия заканчивается после родов. И если она отвечает «да», при хорошем уровне здоровья, она подходящий кандидат.
So one of the big questions that really the doctor is conveying and discussing with the surrogate mother is to make sure that she really understands that her mission ends with, with the delivery. Her role in whole this big process is, growing, caring for the child during the pregnancy observation and, through the pregnancies and the delivery. But this child will not be hers. She will not be breastfeeding this child. She will not be, attached to the child after, and she will not be part of the child life as well. So that's extremely important to for the surrogate mother to understand. And if the answer is yes, not just in, but through the discussions.
Not only physical.
Yes.
Not only physical condition. Мы говорим ей, вы должны понимать, что вы как раковина, которая выращивает жемчужину ювелира. И ювелиром являются ваши будущие родители.
One of the analogies the doctor is using sometimes with the surrogates is like, imagine it's like, you that, shell that is raising, that precious gem, the pearl inside, right? And that pearl is for the jeweler, and the jeweler are the parents. So it does not belong to you. It's growing. So that portion, believe it or not, is really a big side, of the future steps of that pregnancy observation as well. Thank you so much.
И она должна понимать, что ювелир будет проводить огранку этого драгоценного камня. А ее миссия скромна и незаменима. Она дает.
Yes, and she said, doctor says that, and if to continue that analogy, the jeweler, will be then shaping that, that stone, that, that gem, and will have an impact on that gem, but not, but the surrogate has a very important mission. It's a very humble mission, but again, it's very limited in its capacity. This is so interesting, just, conversations you're having. Again, this is mind-blowing to me. So as you are talking, well, let me ask you, have you seen many surrogates who are physically fit, but, as you're describing those things, as you're really putting it into perspective, they realize that this journey is not for them?
I guess about 30% of potential surrogates shouldn't understand finally their mission and their goals. That's why, in spite of their excellent physical form, we should cancel them, because psychologically they are not very good candidates. Because we felt, as a psychologist anyway, that she will be more собственница.
She will be more like an owner. Okay.
Yeah, more owner than we need in her position.
I see. So I guess it's a very, very genuine line, very fine line between, like you're saying, being just, a vessel that cares, and also being the owner of the process. And so what you're saying is that, at least from your experience, by the time surrogates come to you for evaluation, and I know you're not the first one who evaluates them, there is a lot pre-evaluation before that, but even at that phase, you're saying that 30% of surrogates are not continuing, through the next phases, because you're saying that the sense of ownership of the process is much higher than it needs to be.
She shouldn't be involved so much like in her own pregnancy, and she should understand this. I haven't any instrument to measure this part of her mind, but it's only our feelings and maybe experience.
No, absolutely. And thank you for sharing. Again, what you're sharing, as you said, you're OBGYN, over 30 years of experience. You're not psychologist, but I think it's extremely important that you're using some of your intuition and some of your, as you're evaluating, like you're saying, from the medical perspective, you're looking at the emotional side, deeply as well, because to me, it's eye-opening how transparent the process really is, and how transparent you're trying to make it for all parties involved, because the worst case is to give someone hope, get them, to particular parts of the journey, and then they realize that's not a fit. So thank you for doing this due diligence. Now, for the parents, so let's now talk on the parents' side, right? Because they are far away, but you're saying that parents, even though they're not going through the physical changes themselves, there is still some questions they should be asking maybe of their providers, you know, of their circle of support, of their medical team. What would it be?
Я считаю, что первый вопрос, на который пара потенциальных родителей должна ответить самим себе, понимают ли они, что ребенок, которого вынашивает их суррогатная мама, это их родной ребенок. То есть не должно быть разночтений относительно того, что, живя в теле другой женщины 9 месяцев, он унаследует ее кровь или ее генетику или что-либо еще. Это невозможно. И очень важный, я сделаю паузу.
Thank you for bringing it up. So one of the things the doctor suggests that you, all the parents should be considering if you're going through the surrogacy journey is really the question would be, do you really understand deeply, like, you know, heart and heart, do you understand that this child is really yours? Okay, even though this child is being carried by another woman. She says it's vitally important to understand this child. We had some additional questions that came in, you know, can the child, you know, have the genes or cells of the surrogate mother? She says, no, the child is not adapting, you know, the genes or cells of the surrogate mother. The child is yours. And you need to deeply evaluate and understand this question.
Второй по важности, по очередности, но не по важности вопрос, это будущие родители должны понимать, что они могут общаться с ребенком на расстоянии. Да, они могут записывать аудио с колыбельными, со своими голосами. Они могут точно так же читать сказки и отправлять аудиофайлы. Я точно знаю, что наша команда поддержки всячески этому способствует.
Okay. And doctor said another thing that is important to understand that also means, and you know, in discuss, you know, means of communication, not just when you're getting updates, you know, from the team going back to you, but also means of communication between you and a child. And we had a separate question about bonding, so we'll come back to it. But just to touch on that, you know, doctor said that you need, you know, it's vitally important that you are brainstorming those questions of that bonding, including, like, you know, recording your voices, recording your songs, recording you telling stories, you know, reading children's books, whatever it is. It's so important as well. Thank you.
Я обязательно спросила бы будущих родителей, понимают ли они, что детки у млекопитающих узнают, кто у них родители, понимая, кто с ними в момент рождения, после рождения, первые 2 часа жизни, первые 2 суток в роддоме, как воспринимаются по запаху, как прописываются биологические родители в подкорке у ребенка и наоборот. И понимают ли они, что то, как они его воспитывают, формирует личность после рождения. И у меня еще 4-й вопрос.
Okay. Another point, you know, the doctor would have asked you, and she thinks it's important for you to think about as well, as parents, is, do you understand, you know, this whole process of bonding also that happens right after the delivery, within, you know, critical time, within 2 hours from the delivery, you know, where
2 days.
I'm sorry?
2 hours and 2 days.
Okay, 2 hours and 2 days, you know, where, you know, your smells, your sounds, your senses, everything that is being instilled into some conscious, you know, of your child, and also how to best organize that. And I know maternity hospital, you know, works a lot, you know, with your group, you know, with OBGYNs of ADONIS to really make this bonding, what you're describing, as strong as possible. Thank you. And what is the 4th one you said?
4-й вопрос касается того, что будущие родители должны испытывать доверие к клинике, к которой они обращаются. То есть они должны очень хорошо понимать, что мы стараемся подобрать лучших кандидатов, создать максимальные условия комфорта и медицинского контроля за наблюдением беременности. И мы стараемся на разных этапах этого процесса подарить им счастье, понимание, что они скоро будут родителями, что они уже стали родителями. И чем меньше страхов будет в их головах, тем счастливее будет их жизнь в этот период.
Thank you. So another question and thing really to understand, doctors that suggest is, to have a level of trust. Do you have a level of trust to the medical provider, to the process? Because if there is slightest hesitation at any phases, or maybe not on the lack of maybe understanding, lack of information or anything else about, how the surrogates are being selected, what the pregnancy observation means, and at every phase, and if there is a no trust between the doctor who is leading it, and there are a lot of the worries on your side through the process, that's going to be a long and painful journey. So the more positivity there is in that, the better it is for the process and for everyone involved. So how would you, and I didn't have this question, but you're bringing up a question about trust. What are some things that help you build the trust? Or because families are remote, doctors here, we are sending the updates and everything. In your perspective, what builds the trust between the parents and the medical institutions through this long process, and also between you and a surrogate, right? Because, there is a fine line as well. Как вот это доверие тогда, о котором вы говорите, как вот вы это строите между вами, родителями, и между также суррогатной мамой и вами?
We have feedback from our clients and our patients who traveled with us, sometimes more than once. It's first part of your question. And about the surrogacy, it's the psychological thing, and we asked her in different situations. Sometimes we combine stressful situation and observe her reaction. In different situation, her first reaction can help us to recognize, will she good candidates or no?
So, okay, so some of the way of you building trust, so to make sure you understand, before even she starts, going into the stimulation, pregnancy, through all transfer, everything, you creating some of the, not creating, but you simulating, or you asking her, right, about some of those situations that could come up.
Sometimes simulating, yeah.
Oh, sometimes you even training. Okay. Well, that's very interesting. How, I know that you're saying which I didn't have a cell number of my doctor, but I know you're saying that, your patients specifically, you and your team, they have your personal number. Is this true?
Yeah, it's true, because my position, my opinion that our patients, especially pregnant patients, should have our support every time when they need. Clear that when we have a deep night, sometimes I sleep too, and we have two OBGYNs departments, which 24/7 works every time with a great medical and psychological team. So that's why our patient can ask about the support or some medical questions resolving via our call center. If it's daytime or appropriate time between, for example, 8 a.m. till 11 p.m., they can ask us in messengers, via phone, via call center, via email. All variants are possible. And if she has critical questions, she should call immediately in our call center, and they connect the patient with the healthcare provider, nurse or doctor, I guess immediately. And our position, because psychological support of our patients, it's a part of our work, not only medical support, because maybe you know about European Society of Reproductologists. They wrote excellent guide about the healthcare for recurrent miscarriages. And one of evidence-based part of these services is tender care psychological support. It's critically important for patients who had some miscarriages. And good works even if we have positive obstetrician history or no obstetrician history if we observe, for example, first pregnancy. That's why after evidence-based background of this strategy, I'm proud to tell our patients that we share these values and we provide them the same level of support.
Phenomenal. Thank you so much. Let me, and we're going to come back a little bit to the tender care as well. There is some questions that are coming in. I'm going to start asking them as well. There is a question, one of the parents saying that I'm very much worried. You know, as you're saying, you know, worries do arise. And so here's one of the worries. I'm very much worried about the drugs and alcohol intake. I'm assuming you're talking about surrogates. So intake of a surrogate, as it has adverse effect on baby. Is there a way to make sure that surrogate does not take this during pregnancy? Will there be blood tests regular for that? You know, what are your take on that?
Yeah, sure. We can test them via blood test, via urine test, and she is under our observation from different sides of her medical condition. And naturally, that we are not very optimistic person, we are doctors, so we should think about different sides, even dark sides of her mind. That's why we test them, and if we have some doubts, we should examine her more deep. And our reputation and your calmness is our values. So that's why we should provide any tests we need for this case.
That in turn for a different one.
Oh, hang on, I'm going to mute. All right, thank you so much. Is there a difference in pregnancy observation of assisted reproductive technology, like, you know, IVF pregnancy or surrogate pregnancy and regular pregnancy? Is there any difference, or it's completely the same?
Sure, it isn't the same. Both sides, psychologically and emotionally and physically, medically, because we have differences even in the way of IVF pregnancies. We have, because cryo pregnancies, have any differences between fresh pregnancies from fresh protocols. And if we have surrogacy, the same situation. It depends on cryo protocol or fresh protocol. And more frequent visits at the early stages of pregnancy, because ART pregnancies is more fragile than our natural pregnancies, because природный отбор.
Natural selection.
Yeah, because thank you very much, because natural selection in natural pregnancies, it's not our obligation. And during ART, we should observe about this period, about early stages, we should care more tight, maybe. Более тесно, более внимательно.
Yeah, so paying more attention. And you're saying, so one of the big differences between this and the regular pregnancies, there is more visits, there is more things at the first trimester, at the early weeks.
More ultrasound during early stages, yeah, because we should be calm about the normal progress of our pregnancy after ART cycle.
Okay, thank you so much.
Support.
Absolutely.
Yeah, thanks.
Okay. What about also, we get a lot of questions about like hormonal support. Is it something that is always with the ART programs, pregnancy observations, or some women need hormonal additional support and some not?
Usually we use natural progesterone till 6 weeks of gestation every time. And sometimes we should continue more or less till 8 weeks. And if we have any doubts about the progesterone level, because we have the difficulties in the progesterone level in blood, which we can measure, and progesterone level into uterine artery, we can't measure it in this location, the progesterone level. That's why we should keep in our mind the ultrasounds, small signs of progesterone deficiency, or any clinical symptoms of hypertonus, for example. So that's why sometimes we should continue the progesterone support due to half of the pregnancy. Very rare situation till 34, 36 weeks of pregnancy. It very depends on the quality of eggs, if we have natural eggs from our biological parents. And unfortunately, it's very rare, very frequent situation when it's late reproductive age of our parents. And it depends.
Okay, okay. So what I'm hearing again from the medical side, and we're kind of switching between emotional and medical side, but I think it's important for us to understand, for me also to understand that you do customize the program. So it's not just, you know, is it a surrogacy, is it IVF, but what you're saying is the whole process from type of IVF that was happening, you know, type of biomaterial that is being used, and all of this information goes into, feeds into your OBGYN then program, you know, so to me, like, this is really important to know.
Yeah, sure. We have a very strict connection between our, for example, reproductologists, fertility care providers, fertility care doctors, and that OBGYNs who then will observe this pregnancy. So we have in a protocol in the clinic about the providing all embryo transfer protocols, all supporting medical program filling. So that's why when our patient after ART will have prenatal care package, her doctor will know all details of her program, of her background, of the quality of eggs, sperm cells, and all these details are very important for us.
Wow, this is, thank you. Like over and over, we're saying one of the benefits of ADONIS is that we're closed cycle operation, you know, to where it's, you know, it's not piecemealed into the different entities, right? But, you know, one company does something, another one something, but this is just one of the examples where you're saying how tight and integrated it is and how vital it is to the success of the programs. Thank you. Let me ask you, there were a couple of questions that were sent to me right now over email, and they talk about delivery. So let's maybe switch a little bit. And guys, I know we're a little all over the place with our questions, so please jump in as well. But so let's talk more about now bonding between parents and the child remotely. Yes. And then preparation for delivery. And I also want to touch on, what do you recommend? How do you recommend that parents, even though they're far away, for example, they're saying we are in US, and you're saying that it's important to be within first 2 hours, you know, for the bonding with the child. How can we make sure we didn't miss that date? So let's talk. Let's start with the bonding through the pregnancy. Yes, on that emotional side with the baby, and then what parents can do in preparation for delivery.
They should be calm and quiet, positive and beautiful, because it may be one of the greatest events in their life. They should meet their baby. That's why You mean the situation when the parents are far from our delivery room, yeah?
So majority of the families, they not, they are in other countries. We many parents here from United States, from Canada, some are from Europe as well. So let's imagine this situation. But again, like with you specifically, we're talking about this emotional side, and I'm in awe of that conversation that we're having, because again, it doesn't happen. Like I never heard other doctors bringing up, that side of the journey. So first, as they're far away, you mentioned about like recording the voice, reading the books, saying something. Is there anything else? What other things that parents can do to start bonding with the child even during the pregnancy?
I guess that they can make pictures from their pregnancy ultrasounds, pregnancy scans. It's a great picture before the delivery. It's their first meeting with their baby, maybe. And when we prepare them for delivery, they should be learned about first steps about care of their babies. They should be familiar with the basic life support of newborns. They should know about how they should meal him or her, how they do vaccination. They should find the pediatrist or GP specialist who will care in US or in Europe, for example, about their baby. They should buy different prettiest babies things. It's very, very great pleasure during preparing to delivery. And they should choose which way they want the baby will be fed after delivery. We have option of donor milk, breastfeeding, or we can provide artificial смеси.
Formulas.
Artificial formulas, yeah. So according their wish, we should provide the best feed for their baby. And I guess they should have first moment of life of their baby via video, via picture, real picture, not ultrasound scans. And they should be, they should realize that they are parents from the moment of delivery, even if delivery is in Ukraine and they are in another continent or country, it doesn't matter.
Okay, thanks so much. So as we calculating, and I know coordinators are always doing the planning of the exit, there is a concilium between OBGYNs and also maternity hospital, like at the third trimester on the delivery more exact date. But what would you recommend when parents are saying, we don't want to miss that precious time, we want to arrive in time to be at the delivery? What do you typically see? How do you calculate the delivery date? Like we always get questions. When do you think is the due date? When do you think people need to buy tickets in advance? Like talk us through that. And I know a lot of times we're getting a window, but like it's hard to buy tickets and maybe, with a span of a month. So please.
Usually we have estimated delivery date, which is about 40 weeks of pregnancy. But if, for example, it's US parents from another continent, they should buy their tickets for a few months before. I do advise them to have the possibility to be in the country of delivery, for example, from 37 weeks of gestation, if the pregnancy is uncomplicated. If we have some signs about the preterm birth, for example, about 35, 36 weeks, we will let know about this possibility, and I guess that our marketing team, supportive team, let them know about the more earlier date tickets. They, without any problems, will be hosted in Ukraine, because I know that our support team can provide them any variants of the hostels, homes, apartments, and other stuff. If they want, they may use, I don't know, Booking, Airbnb, and other services. But it's very important time, very important part. That's why I understand why your clients asked about. It's great to see the delivery of your baby.
Yep. Okay. No, thank you so much. A question: is there a way for IP moms to take medication to be able to breastfeed herself? So not the surrogate mother, but the, you know, the parents, biological parents, even though they didn't go through the pregnancy. Do you recommend doing this? You know, what can be done? What are the steps?
We have any few medicines that can increase the prolactin level. It's the hormone which should our moms to start the lactation. But very important part of this procedure is to be involved in the pregnancy, during the pregnancy, because not only magic pill should start the lactation. It should be involving psychologically. That's why her base level of prolactin should be enough that to start lactation with these medicines, at least to try. And they should try to provide the breast for baby, because the Sasania sucking, because the sucking process is very critical to support and to start the lactation. That's why they can provide during the, for example, milling with formula, her breast, and she will take the special medicines, and maybe we will have the success. We can begin her lactation. Not very rare, it's about 10-15%, but anyway, it's possible.
Okay, so because parents are, you know, in other countries, so is it then something that they work with the ADONIS medical team remotely to have assignment of those medication and the process, or is it something that they need to do in their own countries with OBGYNs? Like, how does what do you think logistically?
More chances for success if they are near the baby, because the baby's smelling, baby's voice, it's increase her prolactin level, and it should be easier to begin her lactation. If it's far from the baby, it's more difficult, but if she has a wish, she should try.
Okay, but the start of the medication starts before the baby is born. So the assignment of the medication should be done in a country of where the biological mother is located. Is this correct? Or do they need any medication ahead of time? Maybe I'm confused.
It may be possible way, but unfortunately in US, in Europe, it's medicines that you have buy only by a recipe of doctor.
Okay. Okay. All right. So maybe start with the doctor, and then, you know, do come back with the questions and coordinate, and then connect to our medical team to further discuss that and organize that. Okay, perfect. Let me ask that I know you also mentioned, and I know it could affect the bonding as well, as you were talking about it. You said parents need to be transparent about some feelings that they're having. You gave me like a really great example, the way you said biological mother was feeling jealous of the surrogate mother, right? And it's normal. There is no judgment, but, you know, as a doctor is saying, you're seeing those situations. And so it was coming to where, like, if it was not resolved, you know, there could be some negative impact on the bonding with the baby. Also, it was coming across as some negative questions, or maybe some judgment towards surrogate. And there was like emotions going up between both Talk us through those things. Like, I guess what I'm trying to say is like, how could we, because I could imagine like, if I'm not carrying my own child, I would, maybe I will have these feelings and it's okay, right? How to be transparent about it. And if people are feeling it, who do they speak about it? Do they come to coordinator and say, pass it to my doctor? Do they talk to like in maternity hospital? Like how, what does it mean?
If she wants, she can tell about this problem with any our team part. But as for me, the most beneficially should be to tell the doctor or to tell in maternity hospital. It should be medical staff. And we have in both maternity hospitals, the perinatal psychologists. They will help them very effectively. So that's why the main goal of our observation and our conversation with our surrogate, that we let her know that he can tell us any problems, any things, any doubts, and even sometimes she isn't sure that she is good girl when she speaks with us about some side parts of her soul. And if she have this habit during 9 months of observation, usually we haven't problem with transparency of her doubts in maternity hospital and after delivery, because we tell with her about these possible troubles.
Okay, so you're talking about the surrogate both, but also if parents are having some of those, questions as well, and some doubts and some emotions. What I like that you're saying is that we have the professional support at the maternity hospital, right? So those questions could be asked, because priority is just bonding with your child. It's so important for you.
Yeah.
But also if there are any doubts during the process, that again, we are so focused, like you get all of your updates, all of your ultrasounds, reports, by date, when your surrogate going to be seen when. And it's so easy to overlook those emotional side and those questions that, do come up.
One of our principles is no shame, no blame. And that's why we encourage them to speak with us about any uncomfortable themes.
Thank you. And thank you for being so open and bringing it up. Okay. Let me ask you about also, we'll talk a lot about moms, right? But, in the family, surrogacy, there is dad side as well. So what is the role of dad? Like, through all of these programs that you ran, how dads could be involved, how the bonding for the dad could happen, or how dad could be supportive, of biological mother as well, even though she's not going through like maybe pregnancy herself, but everything that goes with it, she's feeling like, she's going to be a mom soon. So what's the role of a dad?
The dad is a giant important person for baby and for his wife. Anyway, if we have the observation of during the pregnancy, over the pregnancy in Ukraine, maybe 90% of our couples went to medical visits together. That's why our dads involved in the process during 9 months, during delivery. So after delivery, they haven't questions about where is, I don't know, for example, my clean t-shirt, or why we have some trash in our house or in our apartments, because her wife breastfeeds and he's happy, it's enough. And during the pregnancy, the same roles about conversation, about communication, about singing lullabies. I advised to choose different songs for mom and for dad. And the same situation during delivery. One difference that he couldn't breastfeed for today, at least. And when they are so far from, for example, surrogate he can be in touch with his baby the same way of her wife. And we provide partner delivery, for example. We haven't single rooms for staying in our maternal hospital. If our patient wants, yeah, she may be alone, but you know that at least 29% of our patients preferred partnership in pregnancy and in delivery. So that's why we don't minimize the dad's role. And anyway, we shouldn't не выводим его за скобки после зачатия.
Yes, so that is integral part of the process, and really it needs to be organized that way. So thank you. How a lot of times we get question about how much recovery time there should be between maybe attempts, okay, or between deliveries. Okay, so let's say we have many families who are asking about siblings' journey. So they went with their surrogate. They love, everything is great. They have their baby. They're saying, I want to have the same surrogate. Yes. How long should recovery be?
It depends on way of delivery. If she has C-section, our recommendation 2 years. If she had vaginal birth, at least 1 year.
Okay, okay. And I know that in some cases we have it even 6 months, but it's really depends. It sounds like, 6 to 1 year, 6 months to 1 year, but it depends on, so the body, the woman will going to go through a lot of evaluation again. So it's not like, cookie cutter approach.
No. She should be recovered. She should be balanced, and she should be full of power, energy, and health to provide for next baby. That's why I guess that we should explain it to the parents.
Okay, thank you. What about, because I know some families here who are going through IVF themselves, yes, and how much time should recovery be emotionally and also physically between transfers?
After the stimulation cycle?
Yes, yeah. So not the delivery, but between the transfers. So there is a stimulation transfer happen, and then maybe didn't result in pregnancy. What would you recommend?
We should think about psychological part. Sometimes our couple or our woman, our patient want to do next attempt the quickest way because she has a goal. In this way, we will recommend her wait for 1 month, for one cycle, free cycle, and then re-attempt. If we have another position, another psychological attitude to her fiasco.
Psychological to the failure. Failure is a tough word, but for them that did not result in success.
Maybe fail, yeah. She should be recovered psychologically. Sometimes she need 3 or 4 months. Sometimes it takes more time, between 6 and 12 months. But usually we actively provide, strongly recommend to solve this problem, solve her sad experience to professionals, to psychologists, because we have a range of psychologists, different gender, different age doctors, and we try to understand our patient that if, for example, she don't like this, for example, doctor, she should try another one, because it's very, very fragile mechanism, the soul of people, and she should be at the same wave. That's why when we have psychological support, usually it takes less than 3-4 months.
Okay, so that's specifically we're talking about patients, who are doing transfer, IVF for themselves.
In their body, yeah, in their body.
Yeah, yes. And why again, do you think, like, how is, maybe it's a dumb question or rhetorical, but still, as a medical professional with 3 years, what impact of that psychology side, emotional side, do you see on success? Like, is it like really that important, or is it like, just?
It's really very important.
So
That's
tell me why. Tell me, like, how do you know? Yeah, like, what are some things you have seen, as a result? Like you're saying, it's coming through the medical side. It is impacting implantation rate. It is impacting, pregnancy success. So, like, what? Tell me more.
Medicine, it isn't a maths. And obstetrician and fertility medicine is a kind of magic sometimes. That's why if I have the same clinical medical situation in 2 couples, for example, and one of them is very optimistic and one of them is very pessimistic, I'm sure that optimistic couple will have a better result in a shorter time. It works this way. I don't know why. Maybe the God and their angels should support their optimistic position. I haven't evidence-based explanation for this observation, but it works. That's why every time when I counsel the pairs, the couples about the IVF or surrogacy program, I advise them, if you don't afraid. If you're afraid, don't do. And that's all.
Okay, so you're coming, come with a full heart, with the possibility of success, rather than being filled with doubts and worries.
Yes, the most difficult is to create a decision. And then the goal is clear and she should move to it.
Okay, all right, thank you so much. Guys, we have like 3 minutes. Is there any, and I'm kind of scanning through questions, and I know some of them will kind of combine, but if there is anything else, there is a question that is not related to the topic. And so it talks about, can we have frozen embryos transferred to Ukraine from US? Yes, absolutely, you can. And I think I'm meeting with you specifically later today, so I can walk you through. We actually do the full coordination of all of the transport, work with the phenomenal companies, that do the hand carry transportation, only hand carry carriers, but absolutely. So, we're doing it all the time. So thank you for the question. All right, okay. Any last, maybe last hopes or anything, or last wishes, like what would you like to have all of our people to walk away today with? Anyone who is listening?
Maybe my last advice is please realize which wish you have, really, because our wishes have the tendency to be true. That's why if you want, please do. If you don't want, please think again. Please consult with healthcare provider in your country. Please use their online or Zoom consultation with our medical team. Please be at the same wave with your husband, with your family, because it's very important for women to be encouraged by the family. So that's why be brave to be happy.
I love that. Thank you so much. Thank you. What a great ending. So thank you, Dr. Mariya. Thank you, everyone.
Thank you.
And absolutely. Okay. Bye-bye, everyone. We'll see you in 2 weeks.
Goodbye.
Bye-bye.
Thank you.